So what is composite bonding? Well, composite bonding is also known as cosmetic resin bonding, cosmetic bonding. It's all about using highly aesthetic, highly durable, predictable tooth-coloured materials to build up what's missing with worn or damaged or chipped teeth. It can also be used to improve the appearance of stained teeth as well. So it can range from all the way from a small corner of a front tooth where it's been hit, maybe a sporting injury or an accident, and the corners come off, and we can just build up the corner of the tooth in a predictable manner so that it matches, you can't see the difference. And it's not that long ago since we were seeing people having crowns placed for stuff like that. So it's far less invasive, which is better for the tooth at the end of the day. Also, again, using minimally invasive techniques, we can use it for fixing much more complicated problems. We see a lot of people coming in with significant tooth wear. So maybe they've got a bad tooth grinding habit, or maybe they've got a significant long-lasting acid reflux problem, and their teeth are wearing away and becoming very sensitive. Using predictable methods, using these modern techniques, we can build up the teeth to look natural and customize them to the patient's personality and physical appearance. So they don't have to be Tipex white, they can be whatever color we want them to be. The beauty is that we don't need to do much drilling, and in many cases we do no drilling at all. In terms of aesthetics, they're fine, they look really, really good. They will see some wear as time goes by, so their polishing may need to be topped up by a hygiene team from time to time. And also, it's also worthwhile in avoiding smoking, avoiding heavily pigmented foodstuffs as well when you've got them, because they will dull with time, just like any tooth would do. So there you go, that's cosmetic bonding. So how long does cosmetic bonding last? It's a variable answer on that one. It's a how long is this piece of string answer. Basically, inside our mouth is a food processor. The teeth grind food and so forth. Therefore, the teeth will wear as time goes by, and so the bonding will wear as time goes by as well. The areas that a good dentist will always check for before embarking on bonding with a patient is to find out whether the patient is a habitual subconscious tooth grinder, particularly at night. And there are clear ways of spotting that. Your trained dentist will know how to spot that. And if the patient is a grinder, then the dentist is going to warn the patient that it is likely that the bonding will wear and will chip at the same speed as the teeth, so it's no different from the teeth going on either side. I always say to patients, if they're coming to have bonding at the practice because they're a tooth grinder, then okay, it may well wear with time, but I would rather see them wearing away the bonding that I place on their teeth than the underlying natural tooth material, because the bonding can always be replaced or topped up into the future. Okay. So is composite bonding permanent? No, it's not. As my previous answer, it will wear with time, and the amount of wear depends upon the amount of load that the patient puts on that bonding. And it's that reason why many of our bonding cases are given protective night guards to wear every night, because it is nighttime grinding that is usually the biggest culprit. So it varies is the best answer. Can dental bonding fix gaps in teeth? Well, yes, it can. It's very, very good for doing that. Quite a lot of patients, especially older patients, come in saying that they've got little triangular gaps between the teeth called dark triangles, and there's a brilliant drill-free technique called Clark matrix bonding or BioClear bonding, where we resculpt, we recontour the teeth, we build out the teeth in a highly predictable, highly planned way, using special resins, using these special molds, which completely fix the gaps between teeth and make them go away. So yeah, absolutely ideal for that. And remember, almost always drill free. Okay. So what's the difference between bonding and veneers? Putting it simply, bonding usually refers to making good teeth using composite resins, so plastic resins. And normally when we're talking about veneers, we're talking about making the teeth look great using ceramics, using ceramic veneers. There are subtle differences in the aesthetics and the durability of the two different things.